Meet Della and Ellie, the two big sisters in this busy family of 5. These lively and cheerful young girls are like most children their age, curious, energetic, and playful. However, these girls face a major challenge. Della and Ellie were born with cystic fibrosis, a progressive genetic disorder that primarily affects the respiratory and digestive systems. Cystic fibrosis is an inherited genetic disease caused by a small defect in the CF gene. Carriers don't have the disease since they only carry one copy of the defective gene, but they can pass it on to their children. When 2 carriers have a child, there's a 1 in 4 chance that child will inherit CF. Mucus plays a key role in your lungs' immune defense by capturing irritants and aiding in their removal. This process helps shield the body from infections. The CF gene codes for a protein called the cystic fibrosis transmembrane conductance regulator, or the CFTR protein. This protein regulates the movement of salt and water in and out of cells. But for those with cystic fibrosis, the CFTR protein either doesn't function properly, doesn't reach the cell surface, is produced in limited quantities, or isn't produced at all. As a result, salt cannot move out of the cells the way it should. Normally, salt helps pull water into the mucus, keeping it thin and slippery. Without enough salt and water, the mucus becomes thick and sticky, clogging airways and trapping bacteria, leading to frequent lung infections that can cause irreparable scarring in the lungs. Several medications are used to treat cystic fibrosis, including digestive enzymes taken with every meal and daily treatments in the morning and evening. Treatment time starts with an inhaler, a nebulizer treatment to help clear the lungs, and time in a therapy vest that inflates and deflates rapidly, putting pressure on the chest to help separate mucus from the airway walls. The first CF medication came out in 1993. Before this, it was unlikely for a child to live past the age of 5, but despite better treatments as the years went on, the life expectancy for CF had only risen to around age 35. That is, until 2019, when a breakthrough drug called Trikafta was released. It was the first drug to treat the underlying cause of CF, dramatically improving the lives of those with cystic fibrosis. Trikafta helps more CFTR proteins reach the surface and stay open, allowing salt and water to move in and out of cells, thinning mucus. Trikafta has increased life expectancy to around 70, with those starting at younger potentially living a normal lifespan. As a baby and toddler, Della struggled with respiratory infections, needing to be hospitalized for 3 long-term stays. Ellie also had 1 stay as a baby. But in 2023, both girls were able to start Trikafta, and neither of them have been hospitalized since.
They go in for their pulmonary lung function tests and their blood draws. Their bodies are functioning normally the way that it should be. And so when they're on their medications, their bodies are functioning as if they're normal, healthy kids.
However, Trikafta costs $326,000 per year per patient, despite only costing $6,000 to make. This creates significant challenges regarding affordability and access, especially since it's just one of the many medications needed, along with other medical expenses.
Cost of the medication has affected us greatly. We've hit our out-of-pocket maximum. We hit it January of every single year. And they're still fighting us to say, you know what, we want that 50% for Trikafta. We're not going to send it to you, which is $15,000 per girl, just the 50%. So per month, that's $30,000. And obviously we can't afford that.
This extreme price also means Trikafta is out of reach for all low and middle income countries, as well as some high income countries. For 5 years, those with CF, along with loved ones, doctors, and others, have been fighting Vertex Pharmaceuticals to lower the price.
Vertex will not budge. I've talked to a mom in Lithuania and in India, and they are watching their children suffocate. They're watching their children die. In the position that they are, they have a lot of room for generosity, and they choose not to.
Many in the U.S. have access to Trikafta, but many are paying a fortune to do so while constantly battling insurance companies. Will they continue to have access, or will the cost drive them to their graves?
It's a very likely possibility that we'll be in a situation where we can't afford it and our insurance is going to refuse to cover. It's heartbreaking to me that they could just take that away at any moment.
Will Della and Ellie continue to thrive, or will their lives be stolen from them too soon? along with all the other CF patients that are out of reach.